Preoperative preparation in a case of toxic goiter. The provided information outlines the general preparation and specific preparation for patients with thyrotoxicosis before surgery. Here is a summary of the key points. General preparation. History and physical examination. Conduct a thorough history and physical examination of the patient. Routine investigations. Perform routine preoperative investigations as necessary for the specific patient. Special investigations. Depending on the patient's condition, consider special investigations, including 1. Thyroid profile, T3, T4, and TSH. 2. Ultrasonography of the thyroid gland. 3. Radionuclide thyroid scan in selected cases. Antithyroid drugs. Initiate treatment with antithyroid drugs, neomercazole, to bring the patient as close to a euthyroid state as possible before surgery. The initial dosage is 10 mg, 8 hourly or 6 hourly, and can be increased to 30-40 mg per day for 8-12 weeks. Once the patient reaches a euthyroid status, reduce the dose to 5 mg 3 times a day. If signs of hypothyroidism occur or if the gland shows an increase, low-dose L-thyroxine, 50,100 mg, may be initiated. Beta blocker. Administer beta blockers, e.g., propranolol 40 mg 3 times a day or nadolol 80 mg once daily, to provide rapid symptomatic relief. Continue beta blockers for 7 days postoperatively. Anxiolytic drug. Consider administering an anxiolytic drug if necessary. Assessment of response. Monitor the patient's response by assessing sleeping pulse rate and repeating the thyroid profile. Lugol's iodine or potassium iodide. Administer Lugol's iodine, 10 drops 3 times a day, or potassium iodide tablets, 60 mg 3 times a day, for 10-14 days before surgery to 1. Reduce vascularity of the thyroid gland. 2. Block the release of thyroid hormones during surgery. Alternative preparation in case of antithyroid drug reaction. If the patient develops a reaction to antithyroid drugs, an alternative preparation approach can be used, which includes beta blocker. Start the patient on a beta blocker like propranolol. Begin with 40 mg 3 times daily, with the possibility of increasing to 80 mg 3 times daily, or nadolol, 80,160 mg once daily. Lugol's iodine or potassium iodide. Administer Lugol's iodine, 10 drops 3 times a day, or potassium iodide tablets, 60 mg 3 times a day, for 10-14 days before surgery to achieve rapid preparation of the thyrotoxic patient for surgery. This alternative approach helps manage thyrotoxic patients who cannot tolerate antithyroid drugs due to adverse reactions. It focuses on controlling symptoms and minimizing the risk during surgery. However, it's essential to consult with a healthcare professional for personalized management and adjustments to the treatment plan based on the patient's specific condition and response to therapy.